Hey everyone, this is Evan Price with the Dialed Endurance Lab, and today I'm here to talk to you about plyometrics. Okay, now, plyometrics can mean a lot of things to a lot of different people. There's a lot of different definitions out there, so today we're just going to talk about how I address them in the clinic for your strength training, for your rehab, and things just to consider when you're doing some of these exercises or just with your running in general. So first, let's talk about what is a plyometric. Usually when we think plyometrics, you're thinking jump rope, you're thinking jumping, you're thinking powerful movements. Those are the two things I want you to think about plyometrics is power and the ability to jump, okay? Also considering that running is a plyometric, sprinting is a harder plyometric, and jumping up and down from high surfaces also is another form of plyometrics. Now, there's a big gradated scale. So as the force increases and the speed increases, think of that as a more challenging plyometric. Plyometrics is all about power, and the equation of power is speed of contraction and the force of that contraction. So you're talking about the ability of your tendons to load and release power or strength, and your muscles' ability to create that strength and create that force. So we're going to talk about a couple things today that are related to that. I've got my knee model right here, okay? We got two really important tendons in this group. You got your quad tendon, which is the one that sits above your kneecap, and you got your patellar tendon, which is the one that sits below. Imagine these for this discussion as your rubber bands that transfer the force that your quadriceps provide. So your quadriceps being the big muscles up here that basically can shorten and change the angle at this knee joint. That is all what we would call tendon loading. So think of when you go to jump. As that knee bends down and I get into this position right here, as this knee model kind of reflects where I'm in, and I go to now unload that pressure, leave the ground, jump in the air, something has to happen at multiple joints, but we'll focus at the knee. At the knee, that tendon on the way down is loading. So it's gaining energy. It's basically taking potential energy at this point. When it gets to a certain point, there's a couple, we're going to talk about a couple proprioceptive organs. Now, that's a really big word to just talk about things that communicate with your brain. The two things that we're going to talk about that communicate with your brain are your Golgi tendon organs, which sit in these tendons. Now, when they get to a certain stretch, imagine it as a rubber band. If I'm your band right here, and this is your patellar tendon, and we are slowly squatting down, when this hits a certain point, those Golgi tendon organs are going to send a signal to my brain that says, we need to release right now. We need to force that muscle to contract. We need to take pressure off this tendon. They do that, and you spring up out of your jump, okay? Now, what that also is tracking is there's also a group called the muscle spindles, which sit in your muscle, so in that quadricep muscle. They are the ones storing information on the speed of contraction through the muscle. So once those Golgi tendon organs say it's time for that tendon to release, the muscle spindles follow suit, and you get a spring capacity, which basically helps you jump. Okay, now that's all a big explanation to say this is a very complex process, plyometrics. So respect them in your training. When you're not a 15, 16-year-old runner anymore who's able to go and play basketball every day, go to track practice, and then get home, rest, and feel great the next day, you have to be careful how you dose your plyometrics. Usually when I'm training somebody, let's say who's no longer a high school runner or a collegiate runner, you're talking about somebody who can probably only take 2 days a week of plyometrics. This is because just as a rubber band ages over time, our tendons do not stay just like they were when we were 16, 17 years old. They start to lose that capacity to spring over and over and over again and then recover the next day. This is for a couple reasons. One is blood flow. Blood flow is not great to tendons. There's a reason that muscles are red and tendons are white. Tendons generally do not have the same level of blood flow to them that a muscle does, so the recovery is not going to be as good. So you have to respect that recovery. Now, when I'm dosing this to my patients, I'm talking to them about, okay, that means a couple times a week, couple, literally meaning 2, we're gonna do these jumping exercises. You cannot be doing them always on running days, and you need to have a day in between where those tendons get to recover. Those tendons and ligaments get that time to recover from that strain and that snap that they were put underneath. So the two biggest principles are really good rest after plyometrics and dosing right. So just like when you slowly increase your weight, if we were working on squats and you said, okay, I started with a 40-pound squat, 2 weeks later I'm at a 60-pound, 2 weeks after that I'm at an 80-pound, treat your plyometrics the same exact way. So I'm gonna give you a couple examples of my favorite plyometrics to work on as a runner and things that you can kind of do at home, okay? Now, remember with these, if you do, let's say 10, and you notice some serious fatigue and your height starting to come down and you're not able to sustain that jumping, that's where you rest, okay? If that's 10 repetitions, that's okay. If that's 30 repetitions, if you're a 16-year-old high school track runner watching this and you're used to doing these in your warm-ups and you do them all day, you can dose a little bit higher, okay? So, the first one I like to work on is literally a skip, back and forth. Now you can start this in place, but then you can also progress it to your movements and your movements at the track. So, 2 on one leg, 2 on the other, and there's a rhythm to it, okay? As you get better, the rhythm can kind of increase in speed, but starting out slow is important. So back and forth. As I get stronger with this, I can speed up, or I can increase the depth of the jump. Speed, depth. Okay, now that's your base one. The next one you can do, and as runners this is hard because we don't move these directions generally, but you can do side to side. So this is called what I like to call rebound plyometric. So I'm gonna jump to the side, and then I'm gonna jump in place before I come back to the other side. So here, okay. You can see it was the same sort of movement as the last one, but we're adding that side to side. And the last one I'll show you is we're just going from one leg. So this is your most advanced, probably most fatiguing type of plyometric is 2 in place, 2 in place. Almost like a hopscotch. You're going back and forth over the line. Good. Now, you will notice pretty early on, there's gonna be a leg that these are a lot easier on, and a leg these are a lot harder on. Make sure that you respect that dosing side to side. So if you have a side that is your easier side, you can do a little bit higher reps on that side. Your harder side, respect that. Don't push this. Make sure you're resting in between. Typically, if you are just starting as a runner and you are just now finding plyometrics and starting to do them, twice a week with at least 48 hours of rest in between is gonna be important so that those tendons and ligaments have that time to recover, and try your best not to do them on run days unless it is an easier, lower load run day. If you're out at the track, don't do 20 minutes of plyometrics and then go out and try to do your track workout. Plyometrics are important to a track workout, but they are not meant to be done frequently before to fatigue you, especially if you are new to running intensity. If you're an experienced runner, if you're younger, 3 to 4 times a week of doing these type of plyometrics exercises and even warm-ups into your track workouts can really be an effective way to increase your speed. But you have to know your skill level, and usually that means on a personal basis you need to go and see a physical therapist or talk to your coach about these type of exercises. All right, that's all I got for you guys today. Remember with plyometrics, this is something worth asking somebody about and starting to learn more about, because it's really something you can help increase your run speed with in the future. Thanks for listening, everyone.